information that we are sharing today is our own personal experience and does not constitute as medical advice. We do not endorse any products or services. Any said products or services mentioned on this podcast may not be suited for you or your condition. Please consult your physician before making any medical decision. Today's episode is sponsored by the Wolfen Chair in Digital Health. Recently, very effective drugs called biologics have become available for children with arthritis. If you have undergone JIA treatment, you may have already come across this treatment or have used it yourself. Biologics rapidly stop joint inflammation and prevent joint damage.
Many different biologics are available, each having a specific mechanism to stop arthritis. So that means that patients may have to suffer several months before qualifying to receive an effective biologic medication, as they're required to fail traditional therapies first, which can take several months. This delay causes not only suffering, but potentially permanent damage.
Can study, a Canada-Netherlands network in precision medicine in childhood arthritis and rheumatic disease, will allow doctors and families to quickly know, number one, who needs biologics, number two, which biologic works best for the individual child, and number three, when the biologic can be safely stopped.
Canadian and Dutch physician researchers formed an alliance, Can Do, together with patients and industry representatives as well as policymakers, to develop the first genomics-based, low-cost biomarker blood test to rapidly identify the best treatment for each individual child, completely transforming the care of childhood arthritis. More about how they want to achieve this will be featured in future episodes. Hi everyone, welcome back to Take a Paycheck. This week's episode features a researcher, Dr. Arif Jetta. Dr. Arif Jetta is a scientist at the Institute for Work and Health, assistant professor at the University of Toronto's Dalla Lana School of Public Health. He's earned his PhD from the University of Toronto and holds an MSc from the London School of Economics and Political Science.
Welcome, Doctor. We're really, really happy to have you here today. Could you start off by giving us like a little introduction about yourself?
Yeah, so I'm based at a Toronto-based organization, and our organization, the Institute for Work and Health, we focus on issues broadly related to the implications of work and how it impacts health, and also how having a health condition impacts a person's ability to work. And so our organization's been around for about 25 years in total, and we've been doing tons of innovative research on this topic, including on how having a health condition as a young person affects the ability to find work and maintain work and kind of advance within your career. So that's kind of how I spend most of my days, is conducting research on that topic. And then in addition, as noted, I teach at the University of Toronto in public health policy. So those are kind of like the two areas that I spend a lot of my time working in.
So cool. What was kind of your interest to actually study, I guess, or research on chronic illness and chronic disease? I guess, do you have any personal connection to it, or is it just you found it interesting?
Well, I think we all have a connection to it, either directly or indirectly, right? And so a lot of people that I know in my family or in my personal life live with a chronic illness. Some have a rheumatic condition, some live with cancer. And it's clear that it has such a significant impact on all aspects of your life, whether it be work, whether it be social life, and just living with pain in general. Watching family members go through that, you can just see the toll it takes both mentally and physically. And I think through that, it really motivated me to study some of the effects of chronic conditions on different aspects of life.
Yeah. And, you can go two different ways seeing chronic illness in your life. Sometimes you go the complete opposite way and you don't want anything to do with it. And sometimes you go into the medical field. Natasha and I are very different. She wants to go into medicine. I want nothing to do with it. So because of that, was that the reason that led you into a career in public health?
Yeah. So in general, I was always interested in health, the health of the population. And I didn't see myself well suited to be a physician and working with people individually. It just wasn't exactly where I saw my career going. And so when I started to think more about what I wanted to do and how I wanted to make a mark on the world, I decided that public health was a really good avenue to do that. And that's because it focuses on promoting health and the well-being of the broader population. And to me, that's pretty exciting through policy, through macro or large-scale research. And I think that ability to have that footprint for me was exciting, and it continues to be exciting, and I continue to find a lot of fun out of my career.
So what led you to focus on youth?
So when I was doing my PhD, uh, one of the goals is to identify an area of work that is understudied and kind of fill knowledge gaps, right? So kind of produce evidence that can help drive policy and help drive programming. And obviously, you don't want to do research on topics that have already been studied or people aren't focusing much attention on. And what I realized is that there's a huge amount of work being done focusing on like middle and older aged adults and how having a chronic condition affects their ability to sustain employment and kind of live fulfilling working lives. But what I noticed was that there wasn't much research focusing on the school to work transition, so entry into work and advancement within the career of a young person. And I thought that was a really interesting gap because what we've found over time is that the early stages of your career can really set the tone for your entire working life. And so if you have success early on, you're going to have success later on in life in terms of your career. But if you have really terrible experiences early, it's going to leave a lasting mark on your working life, and it's going to be harder to kind of progress within your career. And so for me, I just saw there's such big potential to be able to kind of affect people's working lives through evidence and through policy change. And that's kind of why I really dove into this topic a bit more.
I feel like that's so true because like you never really, well, maybe now, but like in the past, like if I hear about research done about youth and the workplace, like it's not a topic that I actually always read about or anything like that. It's kind of always like pushed aside and it's like, okay, whatever, like who cares? So it's great that you're actually like focusing research on that and policies on that. And so you do work with, I guess, or you research on more vulnerable people on a daily basis. So do you think like your values or perspective on this topic has changed from before you kind of got into this work and like now?
Yeah, so I think what's interesting, and I think is a lot of my research is qualitative. So I talk to a lot of people about their experiences entering the work environment, and just the stories that I hear about the challenges and barriers that people living with chronic health conditions face as they're entering the workplace. It's just astonishing, and it just highlights the importance of identifying workplace supports and accommodations that can be useful as you enter and advance within your career. And so I can give you an example. Some of the research that we've done, a lot of the young people, especially those living with invisible health conditions, say that when they're at work, people just presume that they're high energy, they can do physical tasks, that they can work at the same pace as others. But if you're living with a chronic condition, it really weighs on you. And some days you might be okay, but other days you might feel pain, you might feel fatigue. And in those days, when you live with an invisible condition, it's hard to really communicate your difficulties and your limitations. And that creates huge challenges, especially for young people, because when others see a young person, they just see like a healthy individual who's totally fine. But in reality, a lot of people under the surface are struggling with different health conditions.
Yeah. And so I've worked in a lot of different industries. I did lifeguarding from a very young age for about 6 or 7 years. Like I worked in it for a long time, and a lot of it did stem from that. The fact that I had an invisible illness, when you're actually lifeguarding, you're not doing much because, not a lot's going on, but it's in those training sessions. And when, you're picking up a 20-pound brick off the bottom of a pool and, you're swimming with it, that's when it kind of really hits you and you're like, crap. Like if I'm in pain, I can't do it. Yeah. And I'm already a small person as it is. 20 pounds is almost a quarter of my weight. Like, so on top of that, having arthritis, that was not fun. But moving on, I actually ended up working in the hotel industry for about a year before COVID hit. And that was a very different vibe because in pools, it's all young people working and, it's they're very young. And in comparison, the hotel industry is all much older, right? I was the youngest person that worked at the hotel. And I was lucky that I had a desk job where I was just taking orders and, putting them in the computer. But if I didn't have a desk job and if I had to do the serving part of it and lifting and doing all of those things, I can imagine how difficult that must be for some people.
Yeah, and that's why it's really important for young people, especially those living with rheumatic conditions or just any other health condition that has a physical or mental impact, is to really think about your career. Like, where are you going to be working? How are you going to start your career? What types of job tasks will that work require? Will taking a job have a negative impact on your health? Will there be supports available? These are all questions that people really need to think about before they just jump into jobs. But even if it's a summer job, even if it's a part-time job, like these are still considerations that a person should take. And I think that it's kind of a privileged perspective, because some of us can choose, okay, well, I'm going to take one job and not take another, but others are actually, they're forced into certain jobs because maybe they need to make ends meet or they need to support their family. And in those situations, it becomes more challenging because you can't turn down money if you need it, or if you're living below the poverty line. And so it becomes a more nuanced discussion about some of these topics, because it's not just about the work environment, it's also about the personal situation at home and the responsibilities that a person has and their socioeconomic status. And so it creates unique challenges, and I think it's important to think about those as well.
Yeah, it is. Like I honestly, I look at retail and I'm just like, I know that I can't stand there and put things away. So no, I can't work at McDonald's. Everything's going to hurt. Like, it's just, and like, you always come into that mindset that like, okay, I have this condition. I can't do this job. Like, cause you're scared that why would they accommodate you? Like, why? And they won't believe you. And that's why I kind of just steer away from that. And I just do like online, like whatever I can at my table at home. But it's honestly not that fair. Like, if you think about it, like I should be able to also do other things, but be accommodated for it.
Yeah. And so there is laws that require that employers provide accommodations, as long as they're not overly burdensome for the employer. And so I think oftentimes, though, people are scared to ask for them because maybe they will feel like they're going to be treated differently. Maybe they feel like they'll lose out on a shift. Maybe they feel like their colleagues will treat them like they're sick, and they don't want that. And so there's a lot of reasons to choose not to talk about your illness. But I think there's like this balance between communicating and getting access to available supports, or choosing not to. And it's a really interesting challenge, because some people might feel comfortable talking about their illness or disclosing their illness, whereas others, they really don't want to. They feel that it's better for them to not. And in some cases, that's true.
A part of it, especially when you're a youth working, also plays into the fact that you don't look like you're sick.
Yeah.
And that's such a big deal. Like, people look at you and they're like, oh, you're not sick. You don't actually need any of this stuff. Yeah. Right?
Yeah, and then we hear that storyline very frequently, especially when it comes to people living with invisible health conditions. In our research, we've had stories of people living with rheumatoid arthritis, young people, and they'll say to their colleagues, I have arthritis, and their colleagues will pick up their hand and be like, oh, you're too young to have arthritis. Meanwhile, they're in like significant amounts of pain, and they're fatigued, and they're on these like really complex self-management programs that require going to appointments. And so it's obviously disheartening for someone when they are being told that they should be healthy, and why aren't you healthy, and you look healthy. And obviously that's going to make you feel like you might not belong in that workplace.
That's our favorite rumor here at Take a Pain Check. That's the one we talk about every episode. It comes up.
I'm glad to keep it consistent with the other other episodes.
What are some, like, speaking of your research, what are some of like the key themes that pop up in your research on the impact of arthritis at work?
Yeah, there's quite a few. There's so many different themes that one can pop up. I think a big one is the decision to communicate your illness at work. I think that comes up quite a bit because people really struggle with the decision to disclose or to not disclose, especially when you're starting your career. And that makes sense, right? Because if you're treated differently at work, does that mean that maybe you might not get career advancement opportunities? Does that mean that maybe if there's like an opportunity to travel somewhere for work or get an educational opportunity, that you might miss out on that because they'll think, oh, well, they have arthritis, and so maybe they might not be able to do these things, when really there is opportunities if it's accommodated, right? So that's one theme that pops up quite a bit. The second is the fact that a lot of young people start work in very precarious types of jobs, or very insecure types of jobs. So like jobs that are part-time, they're contract work. And these precarious forms of employment aren't really conducive, or they're not really well suited for people with health conditions, because they don't provide health benefits. They don't provide like stability. They don't provide maybe the types of supports that are really helpful when you have a health condition, when you're living with a health condition. That's another theme that pops up quite a bit. And then oftentimes we hear that employers just don't know how to manage workers living with chronic conditions. They just simply they feel like they've never been exposed to someone living with arthritis before. They don't know the types of accommodations they need. There's this like general assumption that if someone is asking for an accommodation, it's going to be this really expensive piece of technology, when really it could just be like a flexible scheduling or the ability to come to work slightly later. And I think that's a lot of the initiatives that we do at our institution, is to really build evidence and capacity amongst employers to like showcase that most of the accommodations that people require are pretty cheap and pretty affordable. It's just a matter of learning and being creative, and that's something that we need to do a better job of advocating to employers. On the other hand, for the worker, I think there's this desire or requirement for them to self-advocate for themselves, which is maybe unfair because maybe their peers don't have to do the same thing. But in reality, they need to be aware of the work environment. They need to be aware about how aspects of work are going to cause injury or illness. They need to be aware of potential accommodations that they can make themselves without actually asking for the accommodation. So there's a lot of different aspects to this topic that we can think about.
Yeah. And in terms of advocating, what would you kind of recommend to, or encourage others? Like, how would you encourage others to do the same and start advocating for themselves when it does come to the workplace? Maybe give like a few pointers.
Well, that's a really good question. And I think maybe I would ask you, like, what, as someone with lived experience, like what are suggestions that you would take or you would tell someone who's unsure of how to manage living with a health condition at work?
Well, last summer I was lucky and I got to work from my bed every day.
Okay.
But when it comes down to it, I would say always disclose that information, because when you do need the help, at least the written proof is there that you don't have to jump through as many hoops at that point.
Mm. And so that's an interesting point that you're making, because we hear that disclosure is both a pro and a con. And it's something that we're trying to understand a little bit more, like the circumstances in which someone should disclose and the circumstances where they might not want to disclose. And so it's nice that the job that you had provided you with an environment where you felt comfortable talking about your illness. But I think in reality, a lot of people don't. And so I think, to your point though, trying to find a workplace where you can feel comfortable telling them about your illness and telling them about the types of medical needs that you have, that's huge. That's a game changer, right? If you can find an employer who's willing to support you, and that's another theme that we hear quite a bit in our research, that workers, especially those with chronic health conditions, they look for employers who are going to support them and that they're going to find a nice work environment. And right now, like in this post-COVID-19 pandemic world, a lot of employers are looking for staff to staff their restaurants or their maybe their retail stores or their offices. And if there's not enough workers, they need to make more effort to engage workers who typically are excluded, like people living with chronic health conditions. And how do you do that? Well, you create an environment that's conducive to them. You create flexibility. You provide work from home arrangements if it's possible. These are all now we know that it's possible to do these things. So let's think about how we can do them and make them available through this post-pandemic world.
Yeah. I mean, I was lucky. I worked for the city of Toronto, so that environment is always very, very inclusive. And all my bosses were my friends at a certain point, so it didn't feel difficult to disclose. But at the same time, when it was in that moment where I was in pain and it wasn't visible, that's when it felt difficult to talk about it and to ask for accommodations.
Yeah, and so I've never lived with chronic pain before or episodic pain, and so I can't envision what that feels like, but I can just imagine that it must be so hard to articulate what pain feels like and what it means to your daily life, and fatigue, and that's another term that people talk about. But as someone like myself who doesn't have fatigue too often, I can't relate to it. So I think it creates challenges in communicating what does that mean for the person as they're going through that. And when you're young and maybe you don't have the confidence to talk about it and describe it, like I'm not surprised why people feel apprehensive about wanting to come forward, because it's such a challenge. These are challenging topics to really talk about, especially in a work environment where, you know, like people expect if you go to work, you're going to be like just getting the work done. And in reality, people have all these different circumstances that they're dealing with behind closed doors. And obviously chronic disease is one example of them.
Yeah, and that's so true. Like, I think it's very difficult to make a decision whether or not you want to disclose it, and it's definitely like whatever you're comfortable with. So just make the right decision. I hope.
For you.
Yeah, for you and yourself. Okay, because we were talking about advocating. We know you from Cassie and Friends. So what is your involvement with Cassie and Friends? How did you kind of get involved? Saw you at the hackathon, and then we were like, okay, we need to contact him. Seems interesting. So give us a little bit of background.
We go to everything with an eye out for guests.
Yeah.
Well, I must say, I saw you guys on Twitter, and I was pretty impressed that you were putting together this podcast. And I thought it was really great that you're putting in all these community leaders and people with lived experience. And I think this is such a great initiative, and I hope lots of people are listening in as your podcast continues to grow. In terms of my involvement with Cassie and Friends, I think just in general, as a researcher, I've always taken steps to try to identify and communicate and collaborate with people within the arthritis community. So I work quite closely with the Arthritis Society. They fund a lot of my research, which has been tremendous, and they're an incredible organization. I also work very closely with the Canadian Arthritis Patient Alliance, in particular, Lori Prue, who I think you guys must know pretty well. And so I'm a big fan of Lori, and she continues to be a collaborator on a lot of my research. She's often a co-author on my research, which is fantastic. And through Lori, I got connected to Cassie and Friends. And ever since then, I've just been in awe with the work that they do. It's incredible. It's grassroots, it's family oriented, it's people oriented, it's applied work. They're really supporting people within the community. And they have so much energy. Like Jennifer Wilson I don't know how she functions, because she seems to be working incredibly hard, but such an incredible advocate in the community. And I continue to look for opportunities to collaborate with that organization, because they have such an important footprint within the arthritis community, and they do such incredible work. And I think what's equally impressive and awesome is that they now are growing out their youth leaders network, which I think is also going to have an amazing footprint as we continue to realize how many youth and young people are living with different rheumatic conditions and the role it plays in their life. I think Cassie and Friends will continue to be that organization in addition to the Arthritis Society and CAPA.
Yeah, Lori, such an amazing person. Literally has always given me so many things to do, keeping me busy all the time. And Cassie and Friends literally has made Trish and I are friends because of Cassie and Friends. Like, this wouldn't be a thing without Cassie and Friends. So thank you so much for everything. Literally, I think like as youth living with rheumatic diseases, we always looked for support. And when we found that through Cassie and Friends, like I can name like 10 people that have arthritis, and that's not something I could do 5 years ago. So definitely, like Cassie and Friends has definitely created like such a big impact on a lot of people's lives, and you don't even have to live with a rheumatic disease.
And also, just maybe to add something, a big aspect of the research that we do is we take this approach, and it's like the technical term is knowledge transfer and exchange, but what it really means is when we produce research, we produce it in collaboration with people with lived experience, with community organizations, with different leadership groups. And the goal is that when we conduct the research, we include those individuals at the start, and they're included at all stages of the process. And by the end of it, we have this evidence or this data that is applicable to those who can use it the most.
So as a researcher, what would your perspective be on what the future of work looks like?
Yeah, so that's a huge topic, and one which we're exploring quite a bit. So the future of work is this really kind of this broad term, and you might hear it in the media quite a bit, or if you're reading the newspaper, if people read newspapers anymore, I'm not sure. But if you're on social media, you might see some articles about it. But The future of work refers to social, technological, environmental, and economic changes that are occurring at a very rapid rate. So I can give you some examples. The first example is the growing use of artificial intelligence within the work environment. The impact of climate change and what that means for workers. It can refer to the growing rise of populism within our socio-political environments. It can mean the automation of work, the growing use of robots, and the Internet of Things, blockchain technology, and cloud computing. There's so many things. And I think what's unique about this kind of current stage is that all these changes are occurring at a more rapid rate than they've ever occurred before. And how will that affect you? Well, it's going to have a pretty big impact on workers, especially young workers. The growing use of technology is going to change the way we work. In some ways, it'll be positive. Like now we can work from home. We can do these types of engagement initiatives online. We can be in each other's homes just through video conferencing. But what it also means is some of our jobs are going to be replaced by technology, or the way we perform certain jobs will be adapted by technology. And what we found in some of our research is oftentimes the most vulnerable workers are going to be most negatively affected by these types of changes. So young workers who work at a grocery store might have their job replaced by one of those self-check kiosks. That's a good example of a thing that's happening right now. Jobs might be like moving to other parts of the world as a result of the growing use of different types of online technologies. But on a more optimistic end, for people living with chronic health conditions and physical conditions, it also means that maybe there's ways in which we can adapt the work environment that it is more conducive for people living with health conditions, right? So maybe having a robot pick up all the take on the physical tasks instead of the person. It could mean that you can now work from home and self-manage a little bit better than you might have in the past. So there's a lot of different ways in which technology and other changes in the future of work are going to both positively and negatively affect us.
Yeah, and I can definitely see that. Like having a robot right beside me, doing the work for me means less impact on my feet. And then technology, technology has literally, I think because of COVID, a lot of people, even in school institutions, are more open-minded to accommodate using technology. And I find that it's kind of ridiculous in a way, because why did the pandemic have to hit for you to understand that we actually have technology and it can do a lot? But I'm glad that sorry COVID, but I'm glad that it's kind of shown people that it can help a lot of people with rheumatic diseases and chronic illnesses in general. It may not have been the right way to show people, but it has happened. And I really hope that it continues that way. Just voice to text is more it's more accessible now. People are okay with doing voice to text. People are okay with us working from home. Someone with a chronic illness we're always high risk to other infections and diseases and stuff like that. So staying at home and working from home is beneficial to us, right?
Yeah, and I definitely agree with that. And that's popped up in a lot of the research that we've done on this topic. But again, I'm going to push back on it a little bit and say that the perspective that we have is a little bit more privileged, because again, a lot of people who would really benefit from these types of jobs that can allow you to work from home or have flexibility, for certain people, those types of jobs aren't available. They're harder to get. They might not be able to access them. And so for those reasons, the ability to work from home, it's kind of what we would say is there's inequities in the ability to access these types of opportunities, right? And I think that's something that we need to tackle at a policy level. It's something that we really need to think about to make sure that people don't get polarized, meaning one group really benefits from all these technological changes and the other group suffers as a result of them. Yeah. And that's kind of where the concern lies.
And I could see that, yes, there may be pros to certain things, but then there's always challenges, and there's so much that we still have to solve and deal with. And it's definitely a lot, but I think we're kind of getting there eventually, hopefully soon. And I think I don't know if every problem will be solved, but if most problems are solved, it'll definitely be really good.
That's a very optimistic perspective. And I hope that that's the case, but I do feel it's a huge, my perspective is that the policy plays a significant role. It dictates the way that employers react to new situations, and workers, it impacts their ability to benefit from potential changes. And so I think that's a big aspect of this conversation is we need to think about who's in charge and what types of policies that they're implementing and how that'll impact the health of our working population, including young workers who are starting their careers.
In your opinion, what are some examples of promising workplace policies?
Yeah, so I think one kind of point that I like to really emphasize quite a bit is when it comes to workplace policies and procedures, the role of the supervisor, the direct supervisor, the one who kind of directly is in contact with the worker, the person's ability to communicate, to be supportive and empathetic, those are kind of what we would call like soft skills, but they play such a significant impact on the worker, right? So if you're going through pain or if you're going through a period of fatigue and you can't talk to someone about it and you can't like bring it up to your manager and you feel like if you do bring it up, they're not going to really respond to it in any sort of way, you're going to not want to bring up those things, and you might work through the pain and you might work through the fatigue and then ultimately get injured, or you might crash as a result, and then as a result you'll end up leaving the workplace for a bit because you'll need to recover from whatever you were feeling. Mm-hmm. But on the other hand, if you have this like supervisor who you trust, who you know will like listen to what you're going to say, who provides you with some empathy, and even if they can't make massive changes, they'll try to be creative and figure out ways in which they can continue to keep you working while you might be going through a bout of poor health. That supervisor is going to like play a significant role in kind of helping you feel comfortable at work, kind of increasing your confidence, allowing you to kind of figure out ways that you can self-accommodate if like more formal accommodations aren't available. So for me, I think that's one of the biggest things is the role of the supervisor. And I think that's something that we try to emphasize quite a bit in our research, is that these supervisors play a significant role in producing environments that are really helpful for people with chronic conditions. But like in addition to that, obviously like at the very high levels of an organization, the ability to have like formalized accommodation policies and to have inclusive work environments, those can have a significant benefit. And I guess just to add to that is that when we create an environment that's accessible to all people, it not only helps people with like chronic health conditions, but it also helps like women who are pregnant, older workers. It helps people with childcare responsibilities. There's so many different benefits that can be obtained from like just a generally inclusive and accessible work environment. Yeah. That to me, it's a no-brainer, right? Like why not just do what you can to like keep your staff happy, because those staff who are happy are likely going to be more productive.
Yeah. Wow. So you've had quite a long career. How do you think you have kind of reinvented labor policies in your own workplace and in these different programs?
Yeah, so I can't say I've like reinvented labor policies, because that's I wish I could. That would be like the ultimate goal. I think there's a couple things that our research has really brought to the forefront. The first being like the importance of the school to work transition and what that means for young people across their working life. I think that's an area of research we continue to really push forward. And by conducting research in that topic, we can start producing like programs and solutions that can assist young people as they kind of make that transition further on into their career. So that's one thing. I think another area that we continue to kind of push forward is this like idea of the changing nature of work, and the fact that the work that we did 5 years ago is totally different than the work that we're doing right now. And I think we need to adjust our social policies, our income policies, our accommodation practices to adapt to this changing world of work. And if we don't adapt, I think the most vulnerable will be affected by it. And so that's another kind of area that I feel like pretty strong about our ability to push that agenda forward. And I think just being able to collaborate with community groups and individuals like yourselves to like talk about some of these topics a bit more, it just kind of gets people thinking more about how they can better manage their arthritis at work or their rheumatic conditions at work. And hopefully maybe some employers are listening to this podcast at some point, and they'll start to think about, okay, well, what are ways in which I can make my work environment a little bit more conducive? Or maybe they might reach out to others for support on that topic, because maybe they might not understand what that means to have a chronic health condition at work. And so these are kind of areas that we're trying to kind of get the word out a little bit more. And I think in the past they weren't talked about as much as they should have been.
Yeah, I hope employers are watching this.
Like if they are, I think like everyone has, like every parent is working at a workplace, or hopefully they have a job somewhere. And if a parent is listening to this, maybe they might be able to not just think about their son or daughter or their child who is living with a rheumatic condition, but also they might be thinking about what are ways in which we can make our personal workplaces more inclusive.
Yeah, it definitely can apply to many people in many different situations.
In our opinion, it sounds like you are reinventing labor policies.
Well,
or at least doing the research in order for change to be made.
Yeah, and that's kind of that's the, like, as an academic or someone working in research, that's always the goal, that, we'll reach the decision makers. But I think one thing that we know, just like I teach policy at the University of Toronto, and oftentimes policy leaders they might not pay attention to the best available evidence, and that's on us. Like, we need to think about how we can elect better leaders, and we need to think about how, as researchers, we can get evidence into the hands of policy leaders. And that's kind of something that we try to do quite a bit at our institution. Is whenever we produce really high quality data or really interesting findings, we will go to the province of Ontario and say, this is an area that is changing, or this is an area of significant impact. You should really pay attention to it. And then we hope that changes will be made. And in the past, there has been some changes that have been made as a result of the work that we've done at our institution. And so I'm optimistic, like yourselves. I'm hoping that that throughout our existence and throughout my research, that it'll continue to hopefully make workplaces more healthy and safer. And that's what I aim for in my research.
Congratulations on your Star Early Career Salary Award. Can you give us a little bit of background about what it is, how you kind of attained it, and what you will be doing with it?
Yeah, so my Early Career Award was funded by the Arthritis Society. And I think I want to give a huge shout out to the Arthritis Society, because they fund a lot of research, which I think is incredible, because they're not only focused on finding a cure to arthritis and rheumatic conditions, but they're also focused on improving the quality of life and addressing social determinants of health, which is kind of the work that I do, and improving rehabilitation outcomes. They're through their funding, they're really driving evidence forward and improving practice and policy for people living with all types of arthritis. So I think that's huge. And so not only are they funding individual projects, but they're also funding individuals like myself, like people at the early stages of their academic careers, to encourage them to continue to conduct research in this topic, or to continue to conduct research on arthritis. And so I've benefited quite a bit from the Arthritis Society in my career. And as a result, my aim is to always give back to the arthritis community and continue to conduct research that is of high impact, so that I can kind of carry the torch that the Arthritis Society has passed to me.
Oh, Trisha's clapping.
Yeah. I very much feel very similarly to you. The Arthritis Society is probably the reason I started getting into advocating and doing all of those things. And it was their camp that introduced me. That was when I first found out that other kids had arthritis too. And one of my closest friends is from that camp. And if I hadn't been in contact with the Arthritis Society and done all of those things, I don't think I would have been in that situation or even learned about the camp, and I probably wouldn't be here today. So definitely thank them for that. What advice would you give to vulnerable youth entering the labor market? Yeah,
so that's obviously a really challenging question to answer, because it's obviously it's a very what we would say heterogeneous, or it's there's so many different young people who are facing barriers to employment, and each individual has unique challenges, but they also have intersecting challenges, right? So we can think about the fact that someone who's a racialized community and living with a disability and a woman, those individuals might be facing certain challenges, whereas those who are Indigenous and who are living in a rural area might be facing other kind of challenges to entering and advancing within the labor market. So I don't think there's a clear-cut response to that. I don't think I can even it's just a broad question to ask. But what I would say is like there's probably steps that individuals can take to kind of better engage in this like changing world of work. And I think mainly is the ability to obtain job skills of the future. So there's kind of like two main like kind of buckets of job skills that employers are really looking for. The first is like these like technological skills, the ability to like code and to work with like complex technology and to like be able to work with artificial intelligence or work with drones. But then there's also the soft skills, the ability to communicate, the ability to have empathy, the ability to collaborate. These are also skills that are important, and they can't be automated by a machine because they're very human skills, right? And so I guess my like tip that I would give to any young person, whether you're feeling vulnerable or you feel like you have barriers to employment, is to identify as many opportunities to upskill yourself for the future of work. And obviously like getting a formal education is important, but there are other ways to do that as well. There's ways in which you can like gain skills within your local community. You can take online courses that are sometimes free. You can look for upskilling opportunities within organizations across Canada. There's a number of different ways in which you can kind of gain these two buckets of skills. And I think that would be probably the biggest message I would give to all young people. But I do have to acknowledge that individuals face challenges to education the same way they do to employment. And it's important to acknowledge that and to think about ways in which we can advocate our governments to ensure that these training opportunities are available to all people, regardless of their like socioeconomic status, or regardless of their race, or regardless of their gender, or regardless of whether or not they are Indigenous or not. Like we need to really think about ways in which we can improve like work opportunities and educational opportunities for all groups of people.
It's difficult. I know I have a couple of friends that graduated from university this year, and it's difficult to find jobs. Even if you don't have a chronic condition, it's so hard. And I feel like coming out of university, a bachelor's degree doesn't even feel like it's enough anymore.
Yeah.
Right? Yeah. And you're coming out and you're like, oh, I don't have a job. I don't know what to do. And I think that's where you're so right. Like having those other soft skills, being able to have those soft skills really can push you over and above someone who has the technical skills the same way you do.
Yeah, and I talked about, like when we talked about the future of work, I talked about barriers, but I also talked about opportunities. And I think this idea of like empathy and communication and building soft skills, these are skills that oftentimes people living with disabilities and people living with chronic health conditions can really relate to and really hone in on, because they know what it feels like to be marginalized. They know the importance of being able to communicate and to empathize with others. And so for that reason, I think there are opportunities in which people can like take their lived experience and use it as like an asset as they kind of enter the working world. But I guess it's easier said than done, right? Like it's easy to say that, but then in practice, what does that mean? But I think being able to like think about how you can play a unique role within your work environment, I think is something that people need to really like look into a little bit more. And you're right, like oftentimes it feels like a bachelor's education isn't enough. And I would probably agree in many cases, but are there specific skills that you can gain outside of like a formal institution that will make you attractive on the job market?
Yeah, I agree. So thank you so much for coming on to our podcast today. We definitely covered so many topics and something that not everyone knows about or talks about, youth being vulnerable in the workplace and just the workplace in general. We hope everyone enjoys this episode. Like, comment, subscribe, check out Dr. Jetha's social media accounts, the work that he's doing, and we'll see everyone next week on Take a Pain Check. Bye. Cause growing pains are keeping me up and